Hi everyone, we'll just wait a few more minutes for some of the other students joining and then we can get started. If you need to go grab a drink or something, please go and do that now before we start. Oh. We'll just wait until 2:01 or something like that for a few more people to come in. Okay, what I'll do is I'll try and get started, and then if anyone else is going to join us, I can catch them up with what we're talking about. But the first few slides will just be introduction and stuff like that anyway, so people won't miss much. But for those who are here, I don't want to keep you guys waiting any longer. So this surgery is on qualities of a good doctor. So we'll just go through some like GMC guidance and some cases that are quite new, or well, not quite new, but they've been going on for a few years. And it's something that you might be asked about in the media, that's been going on in the media in your interview, sorry. So if you go to the next slide. So just a little bit about me. So my name's Shruti. I'm studying at University of Bristol and I'm in my 4th year, so just in my penultimate year. Last year I intercalated in Imperial and I did my degree in endocrinology. So for people who don't know what intercalation is, it's essentially like a year where you have the option of taking an extra year to study a field of medicine that you're interested in. And you can do that at your home university, or you can go to a different university and study it there. Obviously, regardless of whether you're studying in your university or in a different one, you have to do like an application process and stuff. And it just helps you develop your research skills and your writing skills for research papers. So that's essentially what it is. So some universities are compulsory 6 years where you have to intercalate, and then other universities like Bristol, for example, you can intercalate if you want to. By taking an extra year out. So before I go into what the qualities of a good doctor are, can people put in the chat, which I'll just double check if it's been disabled or if it's enabled or something, because sometimes it tends to be disabled. Hang on. Okay, there we go. It should be visible to everyone now. So in the chat, can you guys just type what you think are the qualities of a good doctor? Just shout them out in the chat. I'll give you guys a few minutes. Apologies for me coughing. during this webinar. Okay, so someone said good communication skills, so that's come through quite a lot, which is really good. A few people have said resilience, which is really important as well. And then other people have said communicating with patients without using jargon, so that's really important. Confidentiality, of course. Teamwork, yeah. Being patient and empathetic, yes. And then compassion and empathy again. So yeah, all of these are really, really good qualities of a doctor that you guys have come up with, so well done. So these are the three main bodies that you'll probably be quite aware of. I think the one that you guys must have been most aware of is probably GMC, and maybe a few of you may know about BMA, and then some others might have heard of Medical Schools Council, but I didn't really hear much about them until I came into university, because they're the ones who write your finals exams papers, and they're the ones who set it. So essentially GMC is the General Medical Council, and they're basically the medical body who come up with rules and regulations about what you're supposed to be, how you're supposed to be behaving professionally, and things like that. And they're the ones who look over the hospitals and things like that. BMA, on the other hand, the British Medical Association, tends to be more reporting on current political events related to medicine. So currently, obviously the junior doctor strikes are going on. So they're the ones who did the ballot and stuff like that. They're also sort of an association which I guess in a way protects doctors, and it tells us like what to do if we do come into difficult situations with patients, like, for example, medical legal issues. There are some other medical defense bodies as well. One of them is BMA. And then we have Medical Schools Council. So these are the ones who regulate teaching in medical schools and make sure that everyone, regardless of which medical school they go to, they have a standardized way of learning. And standardized exams as well, especially in your finals year. So there's the three different bodies that you should be aware of. And collectively, all of them sort of set the standard for what they expect in a doctor and what qualities they expect in a medical professional, basically. So one thing I'd really highly recommend reading before your interviews, which some of you might have already done as part of your situational judgment practice for your UCAT exams, is to look at the Good Medical Practice Guidelines. It was come up by the General Medical Council, and essentially what they are doing there is just they have lots of different sections to talk through what they expect from a medical professional. I'll go through the different sections in a minute, but it's a very good guidance to read through. You don't obviously have to sit there and read through the entire guidance, but just have a good understanding of what they expect, because a lot of the questions that you get asked in a medical school interview will be testing you on the skills that they've described in this book. Which you can find as an online PDF for free as well on the GMC website. So just type in Good Medical Practice Guidelines and you should find it. So essentially the kind of things they test you on are three different sections, which I'll go through in a bit more depth, but one of them are like knowledge and skills. And then the other one is like communication skills and stuff like that. So there's different domains and they expect you to sort of meet all of them. And in a way, this is the criteria they kind of use as a basis for your medical school interview. So for example, with communication, they might ask you a role play scenario, or they might ask you to ask you about your communication skills, or to describe where you had to work in a team where it was very difficult to communicate and what you learned from it. And things like that. So that's essentially how they structure their questions. So it's a very good sort of book where you can get a lot of hints into how to answer these questions. This one is something I hadn't really heard of. So the MSc came out with another PDF, which is the statement on the core values and attributes needed to study medicine. Again, as you can see from the title, it's probably really relevant to you guys, because it will essentially tell you what the interviewers are looking for in order for you to get given a seat at medical school. To definitely have a look at both of them. When I was interviewing, because my interviews were in 2017, obviously my main one was this one. This one hadn't come out yet, but I think both of them are really, really good because they're from the main governing bodies for, being a medical professional. So it would be relevant and be worth it to go through this in your own time between now and whenever your interviews are. So So both of them have the same domains, both the General Medical Council book and the Medical Schools Council book, but the points may slightly vary. So that's what I want to try and go through in a very summarized manner so that you guys understand like how to, I guess, approach these interviews, which may be quite scary for some of you if you've never done an interview before in general. So the first domain is knowledge, skills, and performance. And essentially the GMC guidance says that you need to make the care of your patient your first concern. So when you get given questions such as there's, for example, one of the questions I've had before is you are a medical student on the ward, there's a doctor who's turned up drunk, how are you going to approach this? So obviously abiding by this first law, which says make the care of your patient your first concern, you would need to make sure that that doctor doesn't have any contact with any patients and that they're sent back home, because you don't want them to make mistakes which could directly affect your patient care. And that's abiding by that law. So when you're answering your questions, you need to say, so firstly, I'd approach this person and I would talk to them about the fact that they're drunk and maybe ask them what's going on. But at the same time, also let them know that because they're intoxicated, they won't be able to see any patients today because it puts patients at risk. So you need to say that as part of your answer. So that's essentially what I mean by incorporating these guidances into your interviews. The second point says providing a good standard of practice and care. So that sort of interlinks with the first one. Comparing that to what the Medical Schools Council says, they expect you to have commitment, insight and reflection, personal organisation, academic ability, problem solving, dealing with uncertainty and resilience. So they're a lot more sort of short and to the point in terms of the skills they expect from students. So in terms of commitment, that means like turning up to placement on time and making sure that you are willing to learn. And that obviously links to academic ability as well. As well as personal organization. So if they ask you a scenario where they say you're a medical student on placement, your partner who's supposed to be on the same placement as you has hardly turned up to any of their placements, and as a result they are running behind on their learning, how would you approach a conversation with your partner? And then again, you need to link back to commitment, you need to link back to all of these skills whilst you're dealing with that issue. Okay. Before we move on to that, the next domain, does anyone have any questions? Okay, I'll move on to the next one. If someone did have a question, please just type it in the chat as I'm talking, and I will refer back to them as I go through the slides whenever I see the question, or at the end when we have the opportunity for a Q&A session. Okay, so moving on to the second domain, which is on safety and quality. So essentially, this is just making sure that you're safe, but also you keep your patient safe. And whilst doing that, you need to provide the best quality of care for them as possible. So the General Medical Council essentially says to take prompt action if you think that patient safety, dignity or comfort is being compromised. So say if you they give you a scenario where you notice that a patient is quite tearful, making sure to go and speak to them and ask them what's going on. Are they worried about something in particular? Or are they, not very comfortable in that ward, and things like that. So that's kind of what they expect you to do. Just seen a question come up. What's the drunk person? What if the drunk person ignored you and carried on? You would have to escalate the situation in that sense. And you'd have to say, I'm going to have to report this to somebody else, somebody more senior, try and keep them in the room, away from patients as much as you can. And obviously in that situation, you would be a medical student, so it might be a little bit more difficult because they're a doctor. But just having that courage to go and speak to the staff nurse on the ward, or another doctor, another colleague, where you can just say to them, look, this person has turned up drunk. I've tried to have a conversation with them. They're still not listening, and I'm worried that they might compromise patient safety. So can we try and ask them to go home? Can we do something about it? So you wouldn't try and sort it yourself. You would always escalate the situation. But there's certain types of structures to these sorts of questions, which if you look on the 6med book or the 6med website, you can see how to approach each of these questions. I'm just talking through them off the top of my head. So they may not be the perfect sort of question, but similar questions, they all have a certain structure that you can follow in order to get the maximum marks. So obviously have a look at those resources online as well. But it's always, if you can't sort it out yourself, escalate. Never escalate it first, because obviously you haven't done anything. You need to try and make an effort to do something first. And then if you can't solve it at a small level, then you escalate. So there's a mark for making sure you appropriately escalate as well, rather than escalating early, because then that wouldn't mark you down in your answers. But they'll talk about that more on your online resources. The next bit says protect and promote the health of patients and the public. So essentially what that means is if a patient comes in to a hospital, I'm just using some examples from my experience at uni, a patient who's come in and they're saying they have really bad headache and they have a really stiff neck. So those are signs of meningitis. And meningitis is a communicable disease, so it's easily spreadable, especially if you're living in close contacts with other people. It's your duty as a doctor or as a medical student to notify that to infectious diseases, to promote the health of other patients and the general public as well, and make sure to isolate them. Another example is COVID. So if someone was really COVID positive during the first wave of COVID, for example, they would have to have been isolated so that they're not putting other patients or the members of the public at harm. So that's kind of where that point comes in. Comparing that to the Medical Schools Council, so it says to manage risk and deal effectively with problems, and also personal responsibility again. So that combines both domain 1 and 2, and conscientiousness and insight into your own health. So for example, whether that's your mental health or your physical health, if you notice that deteriorating considerably to the point where it's affecting your studies, it's your duty as a medical student to inform your course tutors and the medical admin people who look after you, so that you can get the appropriate time off, or you can get those extenuating circumstances for whatever coursework you need to get done. So it's your duty to go and seek help, but also inform others that you are not well, and you're in a state which can affect your university work as well. So those are the kind of things. I actually think I prefer the way the General Medical Council word the actions in their domains compared to Medical School Council. So if it were me, I would more sort of read through the GMC guidelines. But if you guys seem to prefer the Medical Schools Council one, make sure to look through that one as well. Essentially, they're saying the same thing, just in slightly different ways. And I guess MSc is more targeted towards medical students, but in my mind, I'm just thinking, even if I'm interviewing for medicine, I'm not just thinking to the level of a medical student, I'm thinking to the level of a doctor. So that's why I would prefer going with the GMC ones in order to learn for my interviews. But obviously up to your preference completely. Okay, moving on to the third domain. So this one's on communication, partnership, and teamwork. And I think a lot of you said that's an important skill that all doctors must have, and you're absolutely correct. One main reason for it is because in hospitals, as well as in GPs, we work a lot of the time in multidisciplinary teams. So it's really important to be able to communicate information between each other, and also work together and listen to other people's ideas in order to provide the best possible care for that patient sitting in front of you. And obviously, as part of that multidisciplinary team, a lot of students, when I'm doing MMI practice interviews or mock interviews with them before their real ones, when I ask a question about multidisciplinary teams, a lot of them fail to remember that the patient is also part of that multidisciplinary team. So I think a few of the questions I've asked in the past is, who do you think is the most important person in a multidisciplinary team? A lot of them have said doctors, which then makes you fall into the pit of the interviewer then asking you a follow-up question saying, okay, doctors do this, but actually nurses have more of a role in direct patient care. So why did you not say a nurse? Or if someone says a nurse, then they'll say, why did you not consider going into nursing? Why do you want to become a doctor? So I think actually a very good loophole around that is to say the most important multidisciplinary team member is the patient, because because without them, you wouldn't have a team to begin with. But if you do think, say, a pharmacist or a physiotherapist or occupational therapist is more important, then obviously making sure to justify why. Sometimes a lot of people also find another loophole, and the way they answer it is that every member of the multidisciplinary team is equally as important, because they all do different things for the patients. So those are two good answers. So either the patient being the most important or everyone being equally important is a good way to tackle that question, because it's quite a difficult one. Okay, so going on to talk about the GMC, what the GMC says. So they say treat patients as individuals, respect their dignity. So that directly links with one of our ethical pillars. Does anyone know which ethical pillar I'm talking about there? Yeah, good, Maria. So it is autonomy. So autonomy obviously means the patients having the right to their own treatment and the right to say yes or no to it, or to have the knowledge of what's going on in terms of their medical care. And every patient has the right to find out this information, and if they have autonomy and if they have capacity, they're more likely to make the right decision in terms of what they want for their treatment as well. So this point directly links to that ethical principle. The second one is working in partnership with patients. So, 20, 30 years ago, the way things would work is the patient would come in, say they have a certain symptom, and then we would say they have a certain condition, and we would just give them a tablet without asking them for their opinion on whether they want a tablet in the first place, or whether they just want to deal with it through other sorts of therapies other than medication. And essentially what happened in the past was that most people just tended to follow what the doctor said, without actually working together with the doctor to find the best sort of treatment for them. So for example, with mental health issues, there's two different ways to go. You can go through the tablet route, where you just give them a medication, or you can go through talking therapies and actually talk through your issues. Some people obviously respond a lot better to just taking the medication, whereas other people tend to respond to talking through things and not medicating themselves. So the fact that we now take into account patient preference and what they want out of their treatment actually shows a lot more success rate than just us giving a tablet to them and saying, we know best, this is what we're going to give you. So working in partnership with patient is a lot better than what we used to do in the past, which was more of a paternalistic way of approaching medicine, whereas now it's more of a shared partnership. The third thing, so working with colleagues in the ways that best serve patients' interests. So we always need to consider whether that patient has capacity or doesn't have capacity. We need to make the decisions in the best interests of the patients. And that again links with your ethical principles of autonomy, but also beneficence and non-maleficence. So what do we think a patient perceives a good quality of life to be, and as a result, do we put them through surgery, or do we just leave them alone and just give them medication? So different patients will vary, and therefore we need to act in their best interests and what they want. In terms of medical school council, the way they put it is effective communication, including reading, writing, listening, and speaking. So I guess that's more in the sense of being a medical student, and then teamwork and empathy and sympathy. So does anyone know the difference between empathy and sympathy? I'll give a few more seconds if anyone does want to type anything. We've got a few people who've given an answer. So sympathy is feeling sorry, empathy is understanding how they feel. One's understanding the situation in their shoes, the other is feeling sorry for them. Yeah, I think you guys have got the gist of it. So empathy is knowing how the patient's feeling. Sympathy is feeling sorry for them. There's probably a better way of wording it. Yeah, exactly. So empathy is sort of putting yourself in their shoes, and even if you haven't been in that situation, you're trying to understand where they're coming from. Whereas sympathy is, yes, it is in essence feeling sorry for them, but it's more that if you've been in their situation, you're more likely to be able to sympathize with them because you know what they've gone through, so you can sympathize. Whereas empathize is, even if you haven't been in that situation, trying to actively put yourselves in their shoes and thinking about how they might be feeling in order to understand what they want to do in terms of their treatment and stuff. Okay, so a little bit more about sympathy versus empathy. So, so with empathy, we've got a bit more of logical understanding, but also we're using our knowledge-based experiences to try and understand how somebody else will feel. So, for example, if someone has a chronic problem like rheumatoid arthritis, which is where you have swelling of all your hand joints and your elbows, and sometimes it can also, if you have something else called polymyalgia rheumatica, you can also have shoulder pain, back pain, you can have lots of chronic pain. And I think pain is very underdiagnosed, and people just think, oh, it's just a little bit of pain. But when it's constant and it's every single day for the rest of your life, it can have a massive impact on a person's quality of life. So although I haven't had rheumatoid arthritis, because I understand the disease process and how it affects the joints and what sort of symptoms a patient may be presenting with, I can put myself in their shoes and think, okay, if there's going to be lots of swelling in their hands and in their joints, they're probably going to struggle with everyday tasks that I don't struggle with. So things like putting buttons in their shirt, or showering or dressing themselves, or eating, like picking up a fork. And obviously that will impact their quality of life. So even though you don't specifically understand it yourself because you haven't experienced it yourself, you're still using your logical thinking to try and understand how someone else is feeling. Whereas sympathy is, you've faced that experience, so you're more likely to sort of understand the emotions that a person has had, not necessarily because of knowledge or based experiences or logical understanding. So although empathy, I would say, is quite a good trait to have, the most important one is probably compassion, and sort of really understanding that they're going through a difficult time, and actually understanding that, you know, you're there to help them and making sure that they're aware of that. So if you start with sort of not really understanding other people's experiences, but still a little bit willing to support others, that's what we call pity. So you're saying you feel sorry for them. Slightly different to that with sympathy is, I feel for you. So you're feeling upset for them. So you still have a better understanding than in the pity state, but maybe not as much as empathy. So with empathy, it's I feel with you, and then compassion is also saying I can do all of these things, but on top of that, I'm also here to help you with any of the symptoms you have. So that's a very nice graph to sort of differentiate between sympathy, empathy, and compassion. I'll just leave that screen up if anyone wants to take any screenshots, or if anyone wants to make any notes for a few seconds before I move on to the next one. And I'll also give opportunities for anyone to ask questions if you do have anything. Okay, I'll move on now. So the next domain is to maintain trust. Obviously, confidentiality, I think someone mentioned, as an important quality for a doctor to have, and that encompasses trust. And the reason why trust is so important is because without it, we wouldn't have a doctor-patient relationship, and patients are less likely to adhere to their medication that we give them because they don't trust it, and therefore they won't take it if we don't have that good relationship. So maintaining trust is really important for patients' well-being, but also for the fact that they need to take the medication or whatever advice we give them actually, like, seriously. So the GMC says being honest and open, acting with integrity, and also to not discriminate unfairly against patients or colleagues, which links in with one of the NHS core values, which is treating everyone equally and fairly. And also the third thing is never abuse your patient's trust in you or the public's trust in the profession. So that brings in things like social media, making sure not to post any patient identifiable information on there, making sure that if you've seen something, you know, quite difficult, not talking about it to everyone, even if it's your medical student colleagues, you shouldn't really be telling them, especially if it's someone you know or someone other people might know. Even if you don't necessarily use names, it might still be something that, you know, other people can figure out that it's to do with a specific person that all of you know. So just making sure to not talk about very, very, I guess, confidential things in front of other people who don't need to know that information. Translate that to the medical school council and what they expect, so treating others with respect and also taking responsibility for your own actions and acting with honesty. So in a medical student scenario, that could be something like you're writing an essay and one of your friends is asking to have a look at your essay, and obviously there's that risk of plagiarism. So you know, you as a medical student have a right not to give that essay to them, and also just reiterate that plagiarism can happen, even if they don't intend to do it. When you look at someone else's essay, you're more likely to use their points. If you like them, you're more likely to remember them and use them in a rephrased way, which could get both of you in trouble. So thinking about things like that. Okay, does anyone know who either of these people are? Just post it in the chat. We've got something in the chat. Yeah, perfect. So Baogaba is the person on the right. Anyone know who's on the left? To be honest, I didn't really recognize this one, if I'm could be completely honest with you guys. I only knew the right one. I knew Dr. Baogaba. Anyone know on the left? Not sure. Okay, we'll leave it at that. Well, one of the most popular cases is the Baogaba case. And essentially it was a doctor who was working, I think, in the pediatrics department, and then it ended up that a boy ended up dying because obviously there was grueling night shifts and all of that, and I think there's a mistake that happened and that led to a child's dying, and then Dr. Baogaba being disbarred and having her license taken away because she was held responsible for that. And she was on trial. She can't work anything related to medicine anymore. And there was a bit of a divide in that a lot of people were saying maybe it's actually an issue with the way we do our shift patterns, and the way that doctors tend not to have a lot of breaks. Not just doctors, but other healthcare professionals as well don't have sufficient amount of breaks in order to you know, have some time off, and that increases our risk of making mistakes. Whereas other people on the side said, well, she should have said that she wasn't feeling well, or, you know, she was too tired and she shouldn't have made the decision she did. And if she had sort of called for help earlier, then she might have been able, that boy might have been able to survive. So there's a bit of a divide in terms of both. Yeah, so you can have a look in a little bit more depth about that case, but the reason why it's up on the screen is because they could ask you, can you talk about a time where I guess you know, professionalism wasn't maintained in healthcare, and one of the cases you could use as your answer is the Baogaba case. There's a few others as well. So there's Alfie Evans and Charlie Gard. So both cases are quite similar, where they were born with quite I think it was a genetic diseases, and essentially they were their parents were told that they're not going to be able to survive. Um, uh, and whereas I think in the case of I can't remember whether it's Alfie Evans or Charlie Gard now, a group of doctors in America said, oh, if you come here, we can sort it out. But then the doctors in the UK were saying that there's nothing else they can do for that child. And as a result, there's a lot of divide between the doctors and the parents. And that went to court as well as a case after that boy passed away. And they were thinking it was essentially a case about life support, whether to keep him on life support or whether to stop the life support. So have a look at that case as well. So that's Alfie Evans and Charlie Gard, and then obviously the Dr. Baugaba case. A more recent one is the Lucy Letby trial. That's more to do with nursing, but obviously still a healthcare profession. So does anyone know anything about Lucy Letby and what happened in that situation? If you're not sure, don't worry, but that's something that happened end of 2022, beginning of 2023. Yeah, no, you're correct. So she caused the death of infants on the pediatrics ward. Yeah, exactly. So she worked on NICU, so which is the neonatal ICU ward, where a lot of premature babies are born, basically, and then they're kept under watch because they're born earlier than they should be. And they're usually in incubators because they can't control their own body temperature. And whenever she was on night shift, a lot of the other staff noticed that a lot more of those babies who were well throughout the day seemed to be getting really unwell and actually dying. And essentially what they found out was one of the ways she was doing this was by injecting air bubbles into the children. Obviously, we can't have air bubbles in our blood system. It can obviously cause us to die because it can go up to the brain and cause problems there, but also to your heart and your lungs. And then I think she's on trial at the moment. I'm still not sure what's happened because I haven't kept up to date with that news. But if you have a look online, you can learn a little bit more about that case of professionalism in there. Just to go back to this one, so Dr. Baugaba, so this is the boy associated with this case as well, which obviously makes a bit more sense for this slide. So Dina, we can incorporate these cases when answering questions. We don't have to give a personal example or experience. No, for some questions, for most questions, it's your personal experience, whether that's from your work experience or care home or whatever you've done. But specifically, they will ask you, can you tell me about something in the media where they talk about a case of professionalism where you would have to talk about this case, but it's your depth of understanding and the way you talk about it by incorporating, let me go back actually, can't seem to go back. Oh, there we go. Incorporating these domains into your case and how you answer them is what's important. Why did Letby do that to the infants? Did she have any internal issues that she never brought up that caused her to do this? Possibly. I'm not too sure. I think there was talk that she's had quite a bit of mental health issues. I don't necessarily know in depth, so I think it would be worth if you have a look online because I don't want to give you any wrong information. So have a look online about the Lucy Letby trial, but I think there was talk about mental health issues, not sure what exactly happened in that situation, but it would be worth looking up. Sorry, I'm just going to drink some water. Okay. So next question. So where do you, questions worded a bit weirdly. Where could you demonstrate these qualities? Let's have a look. So with these qualities, they're not just sort of linked to, I guess, medicine in general, but, you know, being honest, acting with integrity, maintaining professionalism, maintaining trust and that relationship between the doctor and the patient. You could also translate that to all other different types of careers, whether that be law, business, or computer science or IT, doesn't matter. All of those are very transferable, or even just in daily life at home with your familial relationships, just being honest and acting with integrity. All of that is just, doing morally good. And I think as a healthcare professional, it's even more important to meet those things, because when patients come to you, they're at a very vulnerable state with their health, and they do rely on you a lot. So actually being confidential, being trustworthy, and being honest is really important. And that's why I think they're more strict with medical students and with dentistry and veterinary students than they are with other general students in terms of social media and other things like that, which is fair enough. We get to know about people's lives that otherwise you wouldn't have found out. And so I think it's really important to maintain that privacy. So where can you find out a little bit more about all of these qualities we've talked about? Obviously your work experience placements, but also you could have developed these skills yourself through part-time work that you might have done, because they're all transferable skills, or through volunteering work. The other ways you might have heard about these skills is through like participation in social activities or educational experience. So for the person who's asked me, let me go to the chat again. Do we need to incorporate these cases when answering questions or give a personal example? It would depend on the way the question is worded. If they ask you specifically to talk about a case in the media, then you would talk about a case in the media. If they ask you more of a general question saying, can you discuss a time where you observed a multidisciplinary team, that would be an experience, that would be from your work experience or from your volunteer work or from paid employment. Might not necessarily be a multidisciplinary team, but it's still teamwork. So if you haven't got work experience, which I know some of you may have struggled with because of COVID, it's still fine to talk about paid employment or volunteer work or participating in social activities, whether that be you've been in a team for a really long time, like a sports team or a music team, or an education experience. So maybe you're part of like Matt's Challenge or something like that. So you can talk about all of those things. Okay. So for people who don't know, I think most of you on this call must probably be year 12s applying for medicine next year. Or year 11s. So the way the application deadline works, the UCAS application deadline for medical students, for people applying for medicine, is always the 15th of October every year. So that would be the deadline for UCAS. I think there's talks of changing things like whether or not they should still have a personal statement or change it to questions, or whether or not they should still have the BMAT or completely scrap it. So there's lots of different changes coming in. So obviously keep looking at the websites because the information is changing day to day. The same problem that you guys are having in terms of your entrance exams, we final year medical students are also having, because they're also changing a lot of things for us before we become F1s. So for my year, they're changing a lot to do with the way our exams work and the way our foundation programs work. So I think in general, they're just doing a lot of changes, which can be quite frustrating, which is completely understandable, because obviously you would have had it in your head from year 11 that, okay, in year 12, I'm going to do the UCAT, I'm going to do this, this, and this. But now they obviously might be changing things to make it a bit fairer, but just keep up to date with the websites and you'll be fine. In a way, these changes, I think, might end up working in your favor, because especially with personal statements, a lot of people find it really difficult to fit all of the things they want to say in 4,000 characters. So instead, just answering them in short block questions might also make it easier for you guys to structure your application. So we'll see what happens with that. In terms of aptitude tests, again, I said there might be a few changes with BMAT. I think UCAT is running as it is. I'm not sure, so don't quote me on that. Just make sure you double check the websites in terms of what's happening. With aptitude tests, I would say UCAT, try and sort that out in the summer, especially if you're taking the BMAT as well, because the BMAT obviously has a specific date on which you need to take it. And you don't necessarily need more preparation because it's based on your GCSE and A-level biology, chemistry, physics and maths knowledge, but it's obviously something that you need to revise for alongside your A-levels anyway. So just be wary of what dates and times, and like make sure that your giving yourself enough time to study for both if you are going to do both, and also balance your A levels at the same time. So just really think carefully about your timings and the dates in which you're going to write these. Similarly, interviews, usually interviews start in November and end in April. I would say start looking through the content for it and start prepping for it. After you've done your UCAS application, it's probably a good time to start looking at questions then. With interviews, it can be quite scary because obviously, it's quite high stakes. It's something that, is going to push you to get into medicine. So fair enough, all of you might be feeling a bit nervous about it, but the more practice you do, the more confident you get. So the earlier you start, the better. And then the last bit is obviously the offer. Now, a lot of people panic with offers. So students I've tutored before always message and say, I still haven't heard back from them. It's been a month. The issue is they start their interviews in November. So if you've had a really early interview, you might not find out all the way until until April when they stop their interviews, and then look through everyone who they've interviewed and they decide who they're going to give a place for. So just be wary that it might take a while to get the offers, which was the situation in my case. So I had my interview for Bristol in November and only found out in May, a week before my A levels. So it was quite a grueling time, but if they are taking a while, it's fine. I wouldn't think negatively about it. Okay, so I've talked a lot now, so I'm just going to open the pan to Q&A if anyone has any questions to ask about what we've gone through today, so the GMC guidances, or if you want to talk about anything related to medicine, or if you want to ask about my experiences, I'm happy to spend some time discussing that. I think we've got 15 minutes, so I'm happy to do some questions. But if you're happy with everything that we've talked through, feel free to leave and enjoy the rest of your Sunday. So Olivia, what do you like best or least about Bristol Medical School? Best is probably the way they've structured the course. So in first year, you start placement literally from the first week of when you start university. So alternate Thursdays, you're in GP placement or in the hospital, seeing patients and developing those communication skills and those interpersonal skills, which I really liked. And then I think first and second year is very sort of mostly sitting in the lecture theatre, but also incorporating that with seeing some patients and then doing some laboratory work in order to understand the basic sciences. And then in third, fourth and fifth year, you're in hospital 9 to 5 every day, and you'll be doing different blocks of placements, so different clerkships. So in third year, the first one it's called Pathway A, and you just learn about general medicine. So cardiovascular, respiratory, GI, neuro, you just learn the basics of the body. And then the second half of the year, which is Pathway B, you'll be learning about A&E, ITU, anesthetics and surgery, and trauma and orthopedics, musculoskeletal stuff, and then dermatology, so skin stuff, eye stuff, there's one more, ENT, so ears, nose and throat. So you do all of those surgical specialties plus some sort of acute stuff and general surgery. And then so third year you cover most things, and the reason for that is because in Bristol you do your finals in your fourth year, not in your final year. And the reason why they do that is so that we have a stressful and a stress-free, not stressful, stress-free and nice fifth year before we start F1. So we do our finals this year. So for me, that's coming up in June. And in fourth year, you do all the super specialties. So you'll do 18 weeks of elderly care, and then you'll do 6 weeks of obs and gynae, so babies, pregnant women, 6 weeks of mental health, so psychiatry, and then 6 weeks of pediatrics, so kids basically, and any issues related to that. And then final year, you just have 9-week blocks, 9 weeks in GP, 9 weeks in A&E, 9 weeks in ward-based care, so it's general medicine. And I just really like the way they've set it up, because it just makes sure that you sort of use that final year to cover what you've already covered in third and fourth year, so you feel really confident before you start F1. Things that I don't like about Bristol so much is some of your placements are really far away. So Yeovil and Taunton in Somerset, a little bit quite far to get to. And yeah, I think that's the only thing. The other good thing about Bristol that I've forgotten to say, you get to do student choice placements, which other universities have as well, and they're called student selected components. And with those, you sometimes have the opportunities to go abroad, like Malta. So some people did diving in Malta and they did a project based around that. Some people went to the French Alps and they did a project on altitude. And yeah, so you get lots of different opportunities. Someone said, so Laxia, can they ask you about specific cases like Lucy let be in your interview? If they are going to ask you about that, they will let you know in advance, because this year, I can't remember, I think it was Bart's, they asked specifically about Alfie Evans, the Alfie Evans case, and they gave them an article to read, and they released that article 2 days before the interview for each individual. So if they are going to ask you very, very specific things, they will let you know, because otherwise it's just unfair. Or will they just ask you to give an example, you know, and explain it? Sometimes they will. So if they don't specifically want you to talk about a case, they may just say, in general, in the media, what have you seen in terms of professional issues? And then you can choose whichever case you want to. They won't necessarily prefer one case over another. Olivia, which others did you apply to and why did you integrate at Imperial, not Bristol? That's a really good question. So I also applied, so my top choice was Bristol. I also applied to Cardiff, King's, and St George's. So I did 2 in London and then 2 outside of London, relatively close to home, like an hour or 2 hours drive away. Just because I knew that if I wanted to have some support, I wanted to be able to get back to my family over the weekends relatively quickly. So that was my decision for being more south in terms of all my options. And I got interviews at Bristol, Cardiff, and St George's. And I ended up in Bristol because I just really liked the course. Bristol and Cardiff tend to have a very similar course as well. So if you're struggling between either one, they're kind of very, very similar. So just go with the one which is closer to your house, I guess. Why did you integrate at Imperial, not Bristol? Simple reason was that Bristol didn't offer the types of integrations I wanted. And I kind of wanted a change of scene. And Imperial's a lot closer to my home than Bristol is. So I just kind of wanted a year where I'm going from home and then doing my integration and coming back. And I just wanted the experience of being in London. And I, in third year, really liked in endocrinology, which is everything to do with hormones. And the best place to do that at is Imperial, because that's where they have all the researchers for endocrinology. So that's essentially where I wanted to go, so that I get the best learning experience. So that was my reasoning for going to Imperial. I also applied to King's and I wanted to do anatomy in King's. And then I spoke to a lot of students at King's and they were not so keen on that one. So I decided to go with endocrine at Imperial. And I thought it was, you know, probably the best decision I've made. I had a really good time there, learned a lot. Did you do an EPQ? And if so, what would you recommend as a good topic to do it on? Yes, I did do an EPQ. So my 4 A levels were biology, chemistry, English literature, and EPQ. So English and literature and EPQ were sort of my essay subjects, and then biology and chem were my sciencey subjects. I did it on something completely different. So I know a lot of people didn't do what I did and instead decided to do it on a medical topic so that it was relevant to their medical application. But I just wanted to do something different. And in GCSEs, I did music. And I really missed it in A levels because I didn't end up doing it for A level. And so I actually did my EPQ on, you know, something completely abstract. I did it on music and this particular piano composer that I really like. And I did it on his work. So I'd say, yes, it can be good to do it on a medical topic. But if you really have a passion for something, you're probably going to do better in that rather than try and force yourself to learn a medical topic and do that as your EPQ and not enjoy it as much. So you can do it on either your hobby or you can do it on a medical topic. But for me, it just worked out that doing it on like my own thing was a lot more enjoyable. But yeah, if you're doing it on a medical topic, you can do AI. So artificial intelligence is obviously very, topical at the moment, or you can talk about history of medicine or something like that. It's completely up to you. And I think what you need to do is maybe just do a mind map and think about, write down all the different topics in your head and think about which one you seem to be most passionate about and go with that one. That would be my recommendation. Maria, I'm in year 13. I've got an interview for a BMAT university this week. However, I can't remember what my BMAT essay was about. I remember the question, but not the answer I gave. How badly will this affect my interview? I don't think it should affect your interview that much. You can just say, it's been a while since I've done my BMAT. Could you just repeat like the question, or could you refer to it and just re-answer it? You don't exactly have to remember exactly what you wrote in the essay, because they know it's like a high pressure environment. You can just ask them to say, oh, can you just remind me of what the topic was? They're not necessarily going to ask you exactly what you said in your BMAT essay anyway. And they might ask you questions around it, not necessarily the same question you got asked. So I don't think it's a major issue to worry about. During intercalation, does the course I study need to be related to medicine, or could it be anything? Oh yeah, it's a really good question. So a lot of people think you can only do it on medical topics, which is not true. So mine was endocrinology, but some people did it in literature, English literature, which was something I was considering. In the end, I didn't end up going for it. But you literally just do it. It's like A-level English, where you just do essays, and it's related to medicine in that you look at history of medicine, and the angle of your essay will be related to how different medicine was in the past compared to now, and that kind of thing. And you might be like analyzing poems and books and stuff like that. There's also in Imperial specifically, the literature one was also in Imperial, but they also offer it at Bristol to study English literature, and in Scotland. So there's a few universities who do a BA as part of your intercalation. The other one that Imperial do, if you are really interested in doing business as part of medicine, so if you want to do private stuff in the future, or if you want to go into GP and you want to be a GP partner and you want to have some knowledge of business, you can do an intercalation in business specifically created for medical students, which runs in Imperial, but also in some other universities. But you're going to have a look, because I can't remember off the top of my head. But Imperial does do some other weird ones, which is not like a sciencey medically degree. And even with the sciencey intercalations, if you don't really want to do lab work, there are some intercalations which focus more on patients rather than lab animals. So obviously, depending on your strengths and weaknesses, choose correctly your intercalations. Do you think 3 A levels plus EPQ is better than 4 A levels? Well, that was my case. So I did 3 A levels and then an EPQ. I was going to take, so my initial subjects at AS was biology, chemistry, physics, English. I just did not like physics at all. And I just knew that if I'm going to take it all the way to year 13 and do it as an A level, I'm just not going to do well in it. And that's going to affect whether or not I get an offer. Because I could get really good grades in all the other A levels, but get not so great result in physics, and then end up not getting an offer at university. So I didn't want to take the risk. And also I just knew that I'd have to end up spending way more time on physics and really hating it. And then it might mean that I don't spend enough time on the other subjects. So for me, the best decision was 3 A levels and an EPQ, and it, worked for me. 4 A levels, I think some universities may ask for it, but most universities are fine with 3 A levels. So why put yourself through that torture is my question. So I think it's personal preference. And I do think A levels are quite intense. They were definitely more intense than my first year at university. So I would choose wisely. If there is time, please could you run through some ethical scenarios? If there's only one organ to give as a transplant, who would get it? An older person, teenager, middle-aged person, or who smokes? I will go through that question in a bit. So you've had that for BMAT unis. They have your essay in the interview and can ask you questions on what you wrote. Is this true? They could possibly ask you questions on what you wrote. I think UCL does that, and possibly Imperial, but I haven't heard much about Imperial doing that. I think they ask you questions around it, not exactly on what you wrote. But you can literally just say, it's been a while since I've done my BMAT. I'm going to answer it to the best of my ability and just go from there. I don't think you should worry too much about it. So there's no other questions, so I'll go back to the one that Olivia asked. So if there was only one organ to give as a transplant, who would get it? So the way you would start answering that question, so it's essentially an ethical question, so you need to discuss ethical principles. I think that's something that a lot of people forget to do. They just answer generically and then don't actually mention autonomy, non-maleficence, beneficence, which loses you a lot of marks in that station. So if there was only one organ to give as a transplant, who would get it? Would it be an older person, a teenager, middle-aged person who smokes? Well, the main answer to that question is the person who's going to get it is going to be the person who is a biological match to that organ. So you could start off by saying the most ideal person that this transplant should go to is the person who has a biological match. However, if all of these individuals are a match for this organ, then we would need to consider some other factors. The first thing would be for the person who smokes, you'd have to make sure that they've stopped smoking and they can prove to you that they're going to stay stopped. So just because they've stopped doesn't mean that they're going to stay like that. So they need to prove to you that they will be willing to do that, because otherwise there's no point giving them the organ, because then they're going to start smoking again and then ruin the new organ and then be on the transplant list again. So you need to just make sure that you discuss that with them. So they need to prove smoking cessation. So they're less likely to be considered as a top choice for the liver if they're still smoking at the moment. If it's an older person, you can't discriminate by age. So you can't say, I'm going to give it to the younger person because they have more years to live. We don't know that. Because at the moment we also have an aging population, so it could be the case that the older person lives for ages and does really well with the liver. What you need to think about is that older person actually healthy enough to go through surgery? Because their bodies are obviously take much longer to recover than a younger person. And even after they've had a transplant, because of the operation, they might have a poor quality of life where they can't move as much or they can't do the daily activities that they wanted to do. So what you would need to do is sit down with each of these patients and speak to them. What is important in terms of your quality of life? Do you understand what's going to happen if you have the surgery? If it's a transplant, they all have to take immunosuppressants to make sure that their immune system doesn't attack their own organ. So are they happy with taking that lifelong? If they're on immunosuppressants, they're more likely to get other diseases as well, so things like COVID, so they'll be one of the compromised groups which need to be protected. So are they happy with having to deal with all of that? And if they're not, especially if it's a teenager who needs to go and do things and maybe have a job and be exposed to other diseases, are they happy to be on immunosuppressants and deal with all of these health issues, or do they just prefer not having a transplant? So you would need to ask about patient preference as well. So there's lots of different things to consider in that sense. And that's how I'd answer it. But there's lots of sort of structures online which you can look at. Do you have to actually reach an answer in ethical questions in an interview, or can you just talk through the things you'd consider? Some ethical questions they expect you to answer. So a given answer. So for this one, the one about the transplant, you need to say who you're going to give the transplant to. You can, no answer is wrong, but you need to, whichever answer you come to, you need to be able to justify why you're picking that one. And the way you justify is using your ethical principles. So you can say, I'm going to go with the middle-aged person who smokes because they've, if they have decided that they've stopped smoking, and obviously they are the better biological match compared to the other two, something like that. And then you can say, according to the principle of beneficence and non-maleficence, it would benefit this person the most and cause the least harm, this decision. So you need to talk about that. Did the medics you met at Imperial while intercalating like it? Those who did all 6 years there. I think so. I think in Imperial, it's quite well organized. They do their finals in final year, so they're not like Bristol. So in a way for them, the way it's organized is good. Because my problem when I came back from intercalation into 4th year, which was the year I'm doing my finals in, is that you've spent a year outside of medicine and you're trying to catch up on a lot of medical concepts that you might have forgotten from 3rd year, which Imperial doesn't have, because they have the 4th year where they can still continue to learn, and then the last year where they do their finals. So that's one to think about as well with places like Bristol or Cardiff, because they do their finals a year earlier. I think mostly the consensus was that they did like it. Because it's in London, they do have a few placements which are a little bit out of the way, but so does Bristol. So with Bristol, we have Yeovil and Taunton, and we have Weston and Bath and Swindon as part of our placements. So they're quite, not Bath, but the other ones are a little bit further out than what I thought it would be in terms of the hospitals where we were in. But for the places that you're quite far out, you do get accommodation for Bristol, whereas in Imperial you don't. So there's pros and cons to both. But largely, I think they did like it. Okay, so I think it's just gone 3 o'clock. So I'm going to stop it there if no one else has any other questions. Thanks for asking a lot of questions and being really involved with this session. And hopefully I'll see you guys in 2 weeks' time if I am running that session. Otherwise, you'll meet someone else as well to go through the next topic. But yeah, hope you found this helpful. No problem. Have a good rest of your day.